Hello, and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister, and thank you for having us today.
Well, thank you very much for having me on the program.
Okay, so, Minister, let's start as usual with an update on the current vaccination numbers.
Well, as of yesterday, we've had 216,862 persons receiving their first dose vaccine. We continue to encourage more people to come out and get their vaccines. As you know, recently we received Sputnik V vaccines, 100,000 doses. So we would really like to get more people coming out and getting immunized because we have adequate amounts of vaccines right now to give to people. So I really want to use this opportunity to appeal to persons to really come out and get their first dose vaccines. We've also seen, as of yesterday, we have 83,729 persons who have received their second dose. What that means is that they are now fully immunized. This represents about 17.2% of our adult population. So we are very pleased that those numbers are going up. But again, because we have 216,862 persons already have their first dose, we want to convert those persons from just having first dose to more of them coming and get their second dose. And the reason why we want to do that is because persons who are fully vaccinated would get the benefits, the full benefits of the vaccine, meaning so far we haven't seen anybody who has been fully vaccinated getting sick, coming into the hospital, going into the ICU or even dying from COVID. And as I keep saying, I think that alone is the incentive to really getting fully vaccinated. Now, you can only be fully vaccinated if you get both doses of the vaccine. If you come and you take one, and then you don't come back and get the other, then you're not fully vaccinated. You're only partially vaccinated. So I want to really encourage people to come out and get fully vaccinated. We have a number of persons who would have received the AstraZeneca vaccines. They are now due for their second dose. We have adequate supplies of AstraZeneca vaccine, so those persons who have received their first dose can come now and get their second dose. Once at least 4 weeks have elapsed since your first dose, you can now come and get your second dose. So anytime between 4 weeks to 12 weeks, you can get your second dose AstraZeneca.
Okay, Minister, can you provide a regional breakdown for us as to, I know you had mentioned earlier in the week that Region 6 is leading the vaccination drive right now.
So regionally, there's some disparity between regions and the uptake that we're seeing in the regions. So while overall for first dose we are at 44.5% of the total adult population, there are these disparities within the region. So in Region 1 we are at 52.3% of that region's adult population. Region 2 we are at 41.7%. Region 3 we are at 44.5%. Region 4 we are at 45.8%. Region 5, we are at 48.2%. Region 6, we're at 52.4%. So they're just marginally higher because Region 1 is very close behind. And Region 7, we are at 43.9%. Region 8 is at 28.4%. Region 9 is at 42.1%, and Region 10 is at 13.2%. So the region that is lagging really is Region 10 and Region 8. And again, while we would have seen small increments, we still have to do a lot of work in these regions, and hopefully we can get more people appealing to persons living in these regions to come out and get their vaccines. We have permanent sites across the country, so any day that you decide that you want to come and get your vaccine, those sites are always open. And we have mobile sites. These are teams that would be going out into specific areas to cover that particular area for the day. So whichever of the options you want to use, then you know it's available to you. We want people, however, to make sure that they get their vaccines as early as possible.
Minister, now yesterday you would have mentioned that the ministry would be partnering with several businesses to offer incentive to persons who would be vaccinated. This is at the vaccination drive this weekend. Can you say what this might be?
So this weekend we have a specific drive that is going to happen on the East Coast corridor and on the East Bank. On the East Coast, at the Movitown Massey tarmac, we will be doing a drive-through on Saturday and on Sunday. And on Saturday and Sunday, we're starting at 9 o'clock and we'll finish about 4 o'clock. So we are encouraging people to come to the drive-through and to be able to get their vaccines. We'll also have another tent set up so that if there are people who want to walk through, they too can come and get their vaccines there. In addition to that, a similar thing would happen at the National Stadium, where we'll have both a drive-through and a walk-through. The stadium will go from 9 to 6, and this would also be on Saturday and Sunday. So again, we want to encourage people to come out, make sure they get their vaccines. Now, since we have started the drive-throughs, I think a lot of persons find it to be more convenient to come. They'll be in the comfort of their car. They're able to get, I would say, a fairly efficient service. And that's why I think a lot of people has opted to utilize this way of getting vaccines. One of the things that I would really like to say to persons, if you're coming with your car, just, I mean, if it's possible, bring 2 or 3 other persons along with you rather than come by yourself with your car. I think if you bring more people with you, then we'll be able to cover more persons very quickly. So perhaps you can do a bit of carpooling and get more people to come out on that day. I think that would help us to get more people vaccinated. But even if you can't do carpooling, just come. There's no restrictions. So we just want to encourage everybody to come out and make sure that you get your vaccines. We have a number of companies that have been coming on board to assist in the process. And on this occasion, we have a couple of companies who will be providing some T-shirts to people who are fully vaccinated. So we have the Dicenco Trading, General Engineering Supplies and Services Inc., Terminex, Pest Control, and the Silver Optical. These 4 companies would be providing T-shirts for some of the persons who would be fully vaccinated. They might not be able to provide for every single person who would come, so I guess this would be on a first come, first served basis. So hopefully it would help to stimulate people in coming out and getting their vaccines. We also have some other initiatives, and later in the day we'll probably be able to issue those as well, as more and more businesses come on board to encourage people to get vaccinated. We have a special initiative that we are doing with the Private Sector Commission and the local aviators, persons who own airlines that fly to the interior of Guyana. And that program we are calling a Vax and Fly program, meaning that once you have your 2 doses and you're fully vaccinated, you will get a coupon with which you can enter into a draw. And once your name is pulled, you will get a free flight from wherever you're in, and hopefully we'll see a lot more people coming forward to get their vaccines.
Okay, Minister, now also yesterday we learned that a Barbados woman is being accused of forging a COVID-19 vaccination certificate. Could you say what measures are being taken to ensure that an incident of this nature does not repeat itself?
Well, I guess the police would have to do their investigation to see whether this is so or not. But we are going to take very stringent, serious actions against persons who try to forge these certificates because it's a really serious matter. If you're not vaccinated and you then tender some document to pretend that you have been vaccinated, then you should come, face the full brunt of the law because you're putting yourself at risk and you're putting others at risk. And therefore, we have to take serious action against this. It would also put our entire vaccination program in disrepute if people are going to try to forge these certificates. So we are on the lookout, and we are going to take serious actions if we find anyone violating, you know, trying to forge documents and things like that. So the police, in this particular instance, the police would do their investigation, and I'm sure they will do the necessaries.
Okay, Minister. And now on the international news, the EU lawmakers endorsed the COVID-19 travel certificate. What's Guyana's take on this?
Well, first of all, there have been a lot of discussions on getting a travel certificate, or as in some countries it's called a vaccine passport, so that people can move freely once they are fully vaccinated. And there have been discussions on the pros and cons of it, and some countries have gone ahead and adopted a vaccine passport. And these passports are not only used for international travel, but even to access service within the country. Because if you're fully vaccinated, you'll be allowed to go to different places, while unvaccinated people would not be permitted. So countries have put those measures together because they want to make sure that they keep people safe. Across the world, because of vaccine hesitancy, the WHO has not taken a strong position because many countries still don't have access to vaccine. And if you make that compulsory and there isn't enough vaccine, it can be problematic. But for those countries who have vaccines, they're starting to put measures in place, such as this travel certificate. We in Guyana, we will have to consider what would be our options as we vaccinate more and more of our people. Some of these types of considerations we'll have to take on board, especially if countries to which the airlines who are here fly to would be asking for such travel documents. So if that becomes a requirement, then we probably would have to follow suit. But the way things are going, it looks like a lot of countries are going to be implementing these vaccine passport or travel certificate. But there's still that discussion that is ongoing, but some countries have already decided and they're moving ahead with it. Let's see how in the next week or two, or maybe a little bit longer, how that evolves.
Okay, thank you for that, Minister, and thank you so much for your time today. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy and our social media platforms.